In this micro lecture, I'll be reviewing our topic from chapter 12, antimicrobial treatment. So about 100 years ago in the United States, it was expected that 1 out of 3 children would die due to infectious diseases before they turn age 5. Now, these early deaths in children was mostly due to infectious diseases such as scarlet fever. You had diphtheria, there was meningitis, there was tuberculosis, and several other bacterial diseases. These diseases were fearsome because there was no way to treat them effectively, and they had a huge toll on the world population. Now, with the discovery of modern drugs and medicine during the mid-1900s, this really revolutionized the field of medicine because now we could use these drugs to treat various infectious diseases. So in this particular chapter, we are going to review some of the key concepts in infectious disease. We'll look at the various principles by which these antimicrobial drugs can be used as therapeutic treatments for various diseases. We'll also explore some of the major antimicrobial drugs and look at what is their mechanism of action. And then lastly, there's a huge concern with antimicrobial disease resistance. There are certain medications, antibiotics that are no longer working for the same effective agent. So we'll explore what is leading to these resistant buildup on the part of these infective microbes. And we'll also look at, is there a post-antibiotic era? Are there new inventions for us to explore when it comes to therapeutic control of diseases? So we'll look at all these in this particular lecture. So when you look at the use of drugs or antimicrobials to treat various infectious diseases, the main goal is that we should be able to use the drugs to treat the infected person, to destroy the infective agent. It could be a virus, it could be a fungi, it could be a bacteria, without causing any harm to the host cell. Now, when you think about it from that angle, then we could say there's no perfect drug. The perfect drug does not necessarily exist. That is because every drug may potentially have a side effect, but we can actually establish a satisfactory compromise as we combine different drugs to have different levels of efficacy to treat various diseases. Now, of course, an ideal drug should have certain features, and that should include features such as its ability to be toxic to the microbe and be non-toxic to the host. So we should take drug, and the drugs should be able to work specifically on the disease-causing microbe. Also, the drug should be a microbicidal. So anytime you hear something as suicidal, it means kill. So the drug should be able to kill that microbe and rather not be static. So static, we are looking at it being able to slow down the growth or its metabolic potential. We need the drug to be a microbicidal. It should be able to kill the disease microbe. The drug should be able to soluble. It should get into our body fluid, remain potent for a long period of time, and it should be able to be active to reach various tissues and its target sites. Now, this also would have a lot to do with the mode of administration of the drug. So, for example, certain drugs that are taken orally, by the time they are delivered to their main site of infection, might probably be in a less potent form. So we have to also take into consideration whether we are administering the drug orally, or is it a topical treatment for external infections, or you're doing an intravenous administration or an intramuscular administration. But these are features that we hope to see in an ideal drug. Like I mentioned, there's no perfect drug, but we can always create a satisfactory compromise to achieve an effective doses in the patient. Now we're going to review some key terminologies which will help us to understand this particular lecture. And the first one is a prophylaxis. So these are drugs that are used to prevent imminent infection of a person who may be at risk. So prophylaxis are used on the preventive side of the infectious disease. Now, you could also have antimicrobial chemotherapy treatment. These are drugs that are used to control infections. So when you think about drugs, anything that could affect your body's physiology is going to be a drug. And specifically for antimicrobial drugs, these can be used to control infections within the body as well. Now, antimicrobials specifically are inclusive, and this includes all the antimicrobial drugs, regardless of what type of microorganism it targets in general. Now, there are some substances that are produced naturally from the metabolic processes of some of these microorganisms, and these are called antibiotics. These antibiotics can be used to inhibit or destroy other microorganisms. So you could have antibiotics that are naturally produced, targeting bacteria, or they could target like fungi or protozoa or other types of microbes as well. Now, another term I want us to look at is semi-synthetic drugs. These are chemically modified drugs in the lab. So first of all, these drugs are isolated naturally, and they are slightly altered chemically in the lab. So for example, you can have Penicillin G, which is an antibiotic naturally produced, and then you can have a slightly chemically modified versions in the lab, which we'll talk about. So it now becomes a semi-synthetic because you've changed it slightly. And the main goal for semi-synthetic modification of these drugs is to make sure that they become ideal drugs. So the ideal drugs characteristics that we talk about, the drugs produced naturally and change chemically slightly. Sometimes it can help them to be more potent. It can help them to be delivered to its target site in its effective form, and it can be more efficacious to treat the infections under control. Now, you can also have synthetic drugs. These are drugs that have been purely synthesized chemically under the laboratory setting. So there are some drugs that we'll talk about, and these were completely synthesized in the lab. Now, the last two terms that we're going to look at are what is a narrow spectrum and what is broad spectrum. So each of the antimicrobials that we're going to talk about, they are going to have a spectrum of action, a spectrum of their effectiveness. So narrow spectrum drugs are antimicrobials that are very effective against limited array or types of microbes. So for example, if you have antimicrobials that are going to be effective against viruses only, that means it's a narrow spectrum action of its effectiveness. It can be effective against gram-positive bacteria only. Now, we could also have a broad spectrum, and these are antimicrobials that are effective against a wide variety of microbes or microbial types. So you could have a drug that is effective against fungi, against helminths, against gram-positive, gram-negative. So it's having a wide spectrum of action on different types of microbes. So that will be a broad spectrum antibiotic. Now, most of these antimicrobial drugs, especially the naturally produced ones, which are antibiotics, these are going to be resulting from the metabolic products, especially from bacteria and fungi. And these metabolic products have the ability to inhibit the growth and sometimes even kill all these other microorganisms within the habitat space in there. And when you look at bacteria and fungi, they have a unique gene, which is a selective advantage for them to be able to synthesize or produce these antibiotics, which can also have effect on other microbes in there. So for example, you're actually looking right here. So streptomycin is found within the actinomycetic bacteria, and they are able to release unique chemicals that are very helpful in medicine. They have impacts on our health, where we are able to synthesize various antibiotic sources from them. So we'll be talking about drugs like tetracycline, streptomycin, vancomycin, nystatin, which is a lipid wrap inhibitor. We'll be talking about ivermectin, which is used for parasitic control. All these drugs are coming from unique chemical source released by the phylum Streptomyces, which is within the broad actinobacteria family. So with antibiotics, you are getting some of these unique ones from the source. Now, when you think about other antibiotics that have been discovered, now, one key thing to pay attention to is that before we start any antimicrobial treatment or therapy for a patient, the physician needs to really look at these three key factors. First of all, we need to identify the microorganism that is causing the infection in the patients. And this identification, we can explore it directly through various direct samples we can collect from the patients. We also need to test the degree that the organism is susceptible to the drugs that we want to test. And then lastly, we need to consider the overall medical history or the condition of the patients before we administer these drugs to them. So first of all, let's look at how we'll be able to identify the microbe that causes this infection. We can collect body fluid or specimen from patients, and that would help us to attempt to look at the possible infectious disease agents that can be tested. So body fluid, sputum, stool sample, urine sample, fecal sample, blood samples, all these could be analyzed to identify the disease-causing microorganisms within the sample. And then secondly, we need to consider the factor of how susceptible the microbe is to the particular drug that we want to test. One of the commonest drug susceptibility techniques is the Kirby-Bauer test. Now, this test involves using a Petri plates, which has your testing bacteria that you want to test. And then you can have small discs, which would have unique amount of the antibiotic that you want to test placed on them. Now, one key result we're expecting to see is what we call the zone of inhibition. So this is going to be a zone where we are going to see no bacterial growth. And that will tell us how sensitive the bacteria is to the antimicrobial that we are testing. So this plate right here shows a typical example of the disc diffusion assay or the Kirby-Bauer test. So you have a lawn of bacteria growing on the plate. And each of these discs is a unique antimicrobial drug that has a unique concentration of the drug placed on it. You incubate the plates with the drug for a time of incubation period, and afterwards, you can observe for zone of inhibition. So the zone of inhibition is the clear area where you are observing no microbial growth right here. So within the zone of inhibition, the wider the zone of inhibition, the more susceptible the microbe is to the drug. So how can we tell which of these drugs is more effective to combat this microbe or this bacteria? The drug that has the wider zone of inhibition is going to be the most effective drug that can be used to target or treat the bacteria that is causing the infection that we are testing. So this is going to be one of the key things. So for example, this table right here shows how if you are testing various drugs such as Penicillin G, streptomycin, vancomycin, how you can measure the zone of inhibition and use it to determine whether the microbe is susceptible or is resistant to the drug. Now, we want the microbe to have a high susceptibility so that we can effectively use that drug to treat that particular infection. Now, another alternative to the Kirby-Bauer test is the E-test. The E-test is similar to the disc diffusion assay. The only difference is that it allows us to have various concentration gradients of the drug, and we can test it to even determine the lowest or the smallest concentration of the drug that is inhibiting or killing the microbe in question. So in this E-test, you have a strip and it has various concentration mark of the drug, and we can use it to test also for the zone of inhibition. Now we can test on the zone of inhibition, the clear area, to also help us to identify what is the smallest concentration on the drug strip that we are not observing or that we are seeing a bacteria inhibition or its growth. So we can also tell which drug is effective and also the concentration of the drug, the smallest dose of it, which is also going to be effective at the same time. So with the E-test, it gives us an idea of the efficacy as well as the minimum inhibitory concentration, which is MIC. So MIC, this is going to be the smallest concentration of the drug that you can visibly see that is inhibiting growth in there. This is very useful as it can tell us what is the most smallest effective dose of the drug that we can still use to treat a patient. Now we can also test the minimum inhibitory concentration test, where we can have different concentration of the drug, and then we can test it to observe growth in the microbe. Now you can actually see that in the more yellow tube, you have increased growth, And in the less yellow tube, you have no growth. So if you are looking at this particular drug that we've tested, a concentration at 6.4 and a concentration at 12.8 is going to be more effective to help us see which concentration that we can use to treat the microbe in question. Now, the physician can use the sensitivity test to guide them to select the suitable drug that they give to the patients. And when they use this to select the suitable drug, sometimes the drug still fails to work. And at that point, we could attribute the failure of the drug to work to three main factors. The first is that the drug is not able to diffuse into the body compartments, such as the brain, the joint, or the skin, to get into its target or infective site to work. Secondly, the drug may also fail to work to treat the infection in the patient due to resistant microbe buildup. Now, we may have resistant microbes that were not really captured in the samples that were collected. So this could also be why we probably would not, the physician may not be able to have the appropriate choice of drug to target the microbes in question. And then lastly, sometimes you can have an infection that is caused by more than one pathogen. So this is a multi or a mixed pathogens involved in the infectious disease process. So with this, using one drug, some of the microbes may have resistance to it, which may cause the treatment to fail in there. So for every drug, we have what we call the therapeutic index. And this is where you're looking at the ratio of the drug that is toxic to humans to its effective dose. Now, the smaller this ratio, the more riskier the drug is, but the greater the ratio, the more effective you have a margin of safety when you use that particular drug. So for example, you can have a drug that has a therapeutic index of 1 compared to a drug which has a therapeutic index of 10. The therapeutic index of 10 is going to give you the highest margin of safety in there as well. So the highest TI, which is 10, would give us a margin of safety in there for us to be able to use this drug, which will be effective to treat the disease and also be non-toxic to the human host as well. And this gives us a therapeutic window. And this is the range of blood levels that the drug will be able to produce the desired effect without causing any adverse toxicity to the body or to the cell as well. So again, we're looking at antimicrobial drugs, and the three key factors we've looked at will be able to identify the microbe. You test for the susceptibility. The third key factor is to also look at the patient's medical history. So we have to know the patient's medical history, how they respond to certain classes of drugs. Do they have certain disease allergies? How it impacts whether they have other underlying conditions. Do they have any kidney disease, liver disease, or other chronic disease? Also, the age is also relevant. Are they infants? Are they elderly? Is it pregnant women that you require certain unique precautions in prescribing these key drugs to them? So this is very important in the initial stage to be able to pick the final choice of drug. But even with these factors, it is still not a straightforward process for a physician to pick one final choice of drugs, because when you think about the synergistic or the antagonistic effects of certain drugs and how various drugs that we take has an impact on the overall microbes in our body, which is our human microbiome, the total microbiome in our body. These drugs have the ability to impact it and how it really functions. But in the preliminary sense, these three key factors are still important for the physician to look at. And that is mainly because after you look at the drug and the microbe, again, we want to be able to achieve selective toxicity, where the drug in question should kill or inhibit the microbial cell without causing any harm to the host cell or host tissues. And one of the drugs, which is an excellent selective toxicity property, is penicillin. This has the ability to block the cell wall synthesis in various bacteria without causing any harm to the host cell or the host tissues in there as well. So in this micro lecture, we've looked at antimicrobial drugs and the fact that one unique property about them is that they should be selectively toxic. We've also looked at the fact that the main person who pioneered this field, Paul Ehrlich, so he used arsenic, and the first drug that he came up with was salvarsan that was used for treatment of syphilis. Penicillin G was also one of the commonly publicly used antibiotic after World War II, after 1944, to be able to treat various infectious diseases. We've also explored what it means to have antibiotics, semi-synthetic and synthetic drug, and the fact that there's no ideal drug, and the fact that every physician considers 3 key factors before they can select their final choice of drug for a patient to take to treat an infectious disease. Now, again, aside even looking at these 3 factors, there is no ideal perfect drug, because you could have synergistic or antagonistic effect from drug, and how these drugs could also impact our whole microbiome process as well. So hopefully you'll be able to recapture key details in the notes and summarize them. Feel free to let me know if you have any questions, and I'll be glad to answer you. Thank you.